Hey everyone, and welcome back to the channel. Have you ever taken a really breath deep and just felt where it's fills with fresh? Our lungs tirelessly day out, but then something goes wrong. Today we're going to dive into the diseases sound a bit heavy, but knowledge power and understanding our bodies is the first step to taking better care of them. So what our lung disease is a broad effect disorder the organs that breathe. They can range from mild to life-threatening. Let us break down some of the most common types. First up, we have obstructive lung diseases. Imagine trying to blow air through a very narrow straw. That feels like these conditions make it hard to exhale all the air from the lungs. The most well-known obstructive pulmonary disease, or COPD, is often conditions chronic bronchitis. Emphysema damages air sacs while bronchitis causes airway. The number one cause of long COPD, but like air pollution or chemical fumes, we can also contribute. Another common obstructive disease is asthma. With asthma, the airways become inflamed and day might produce extra. This can make breathing difficult and trigger coughing, wheezing, and shortness of breath. Asthma triggered by all sorts of allergens like to exercise, stress. Next, let us talk about restrictive lung diseases. Unlike obstructive diseases where diseases fully fill lungs with air, your lungs are restricted for fully expanding. Think of it like trying to inflate a balloon, stiff and stretchy. Conditions like pulmonary fibrosis, where lung tissue becomes scarred and stiffened over time, fall into this category. The causes can be varied, sometimes linked to environmental pollutants, certain medications, or other medical conditions, but often the cause is unknown. Then there are diseases that affect the blood vessels in the lungs. The most prominent example is pulmonary hypertension, which is high blood pressure in the arteries that go from your heart to your lungs. This makes right-sided heart work harder, which can lead to problems over time. And of course, we have to mention lung infections. These are probably the ones we're most familiar with. Pneumonia, for instance, is an inflammation that the air sacs in one or both lungs, which may fill with fluid. It can be caused by bacteria, viruses, or fungi. Tuberculosis or TB is another serious infection. This is an actor that mainly affects the lungs, caused by a specific type of bacteria. And then there are viral infections like influenza and, as we've all become very familiar with, coronavirus, which can lead to severe respiratory issues. So, with all this information, what can we do? The good news is, there are many things within our control to keep our lungs healthy. The number one tip: if you smoke, the best thing you can do for your lungs is to quit. It's never too late, and your body starts to repair itself almost immediately. Avoiding exposure to pollutants is also key. This means staying away from secondhand smoke. And if your job involves dust or chemical fumes, make sure you're using proper protective equipment. Regular exercise is fantastic for your lungs. It won't increase your lung capacity, but it improves your body's efficiency in using oxygen. Eating a healthy diet rich in antioxidants can also help. And don't forget regular checkups with your doctor. If you ever experience a persistent cough, shortness of breath, chest pain, or unexplained weight loss, get it checked out. Early detection is crucial for managing lung conditions effectively. If you or someone is struggling with a lung condition, remember there is support available. Organizations like Association incredible communities overwhelmed. Talking to a mental health professional can make a huge difference. Taking care of your mental well-being is just as important as physical health. I hope this overview was helpful and not the goal is to be informed, not scared. Our lungs are incredible. They deserve our care and attention. Thanks so much for watching today. If you found this video valuable, give a thumbs up, consider more health and wellness. Stay safe, breathe deep, and I'll see you in the next one.